Hi, I'm Dr. Mike Hartlett with Integral Medical and Rehabilitation here in Vernon Hills. Thank you for joining us in our series, The Doctor is In. Today we're going to be discussing legs. Now, with legs, we're going to talk about them in four main groups called joints, muscles, nerves, and blood vessels. Within our joints, we have hips, knees, ankles, and feet. And the muscles that we'll be discussing would be something like the quads, the hamstrings, or the muscles on the inside and outside of our thighs. Those are the adductors and abductors. And then we have our lower extremity muscles called our calf muscles, or sometimes the plantar fascia in the bottom of the foot. Some common nerves affected would be something like our sciatica nerves or saphenous nerves, or even the nerves in the bottom of our foot called plantar nerves. And of course, blood vessels can also be affected, like our femoral blood vessels or our saphenous blood vessels, and even the very small capillary beds in the bottom of our feet. Now, common conditions that we typically see within the joints would be osteoarthritis or rheumatoid arthritis, any other degenerative conditions, breaking down the joint, acting like rust on a vehicle. The muscles, typically we see those as either a sprain or a strain. Sometimes we pull muscles. I know a lot of our athletes do that. And even the plantar fascia in the bottom of the foot, when that becomes inflamed for our runners out there, we start to notice a very painful foot or heel. And that can eventually lead to some tears possibly if not treated or addressed. And even shin splints can occur because other muscles are working overtime. The blood vessels, conditions that we see with those would be peripheral artery disease, which is very commonly misdiagnosed as neuropathy or sometimes either or. Other conditions that we see with the legs would be something like a restless leg syndrome or a radiculopathy, and that's very commonly confused with either blood vessels or nerves. When it comes to treating these types of conditions and the areas that they're affected, it's really important, and what we do in our office is actually take the time to listen. We unpack your medical history and we take a very thorough examination of your medical history, because that's really important in pointing us in the right direction to do the proper testing at the right time, at the right place for the right reason. And then we're able to move forward with an actionable plan and a definitive diagnosis. If you'd like more information on some of these topics that we talked about, we're going to be doing some future videos here. Please check out those as they come along, and we'll be talking about those specific conditions more in depth and take a look at each individual condition as we progress in our video series. My name is Dr. Mike Hartlett. Thank you so much for joining us in our Doctors In series at Integral Medical and Rehabilitation here in Vernon Hills.